guys, it's Elizabeth, Finding Elizabeth, and we're here on The Naked Truth. This week we're coming to you live from everybody being in Southern California, which is a little bit unusual. So Patty and I are in Orange County, and we have Dr. Katzen with us, who is in Beverly Hills. And this is a special edition of The Naked Truth. I'm so happy that everybody's tuning in. Dr. Katzen has graciously agreed to do some special shows for us, so we're really excited about that. And we haven't seen Patty in a while.
Hello.
How are you?
I'm doing well, thanks. How are you doing?
Good. It's great to see you.
Thank you. Thank you. Feels good to be here. I definitely am feeling well.
Good.
Okay. Shall we go ahead and introduce Dr. Katzen?
Shall we introduce Dr. Katzen?
So tonight, our special guest is Dr. Katzen, Dr. Timothy Katzen, and his practice is in Beverly Hills, California. Just to give you a little bit of background on Dr. Katzen, he grew up as a child all over the world, in many different countries, and his father was a diplomat in the State Department, and he's got the command of several different languages. He went through his undergrad at Duke University and did his medical school at the Medical College of Virginia. His general surgery residency was at the University of Hawaii, and his plastic surgery residency at Vanderbilt University. He is certified by the American Board of Plastic Surgery, and his focus for the majority has been on working with people who have lost 100 pounds or more over the past 17 years, and his practice is in Beverly Hills, California, and it is our honor to have Dr. Katzen, and it is my honor to be a patient of his.
Well, thank you. Thank you very much.
We're really excited to have you here tonight. Just really quickly, I wanted to touch on my experience so far with Dr. Katzen, and then Patty's going to talk a little bit about why we haven't seen her around for a while and her experience. So I did a whole video on this, I think, last week maybe, but I had a consultation with Dr. Katzen a few weeks ago when Amy was here visiting. He graciously agreed to see me when I followed her into the exam room. So and I'll put a link down to my video where I talk specifically about it, but we talked about several different procedures, which were, and correct me if I get the names wrong, so tummy tuck, right?
Yep.
Arms. What do you call? I call it the side boob surgery. What do you call it?
Sure. I call it a torsoplasty. It's
Okay.
It's the torso, and plasty is just to adjust it or make it different. So we're removing it.
Right, and that sounds way better than what I call it. So arms, torsoplasty, stomach, neck, and what am I forgetting? I thought there were 5. Arms, stomach. Oh, breasts, of course. Yeah. So those were the things that we talked about doing. We're probably going to do those in 2 different procedures, or 2 different days. And
Yep.
right now, because I'm still, if I'm doing everything I'm supposed to be, I'm still losing a little bit of weight. I am going to try to really push that over the next few months and make an appointment to see Dr. Katzen, maybe in May, after I come back from WLSFA in Nashville and see where I'm at. But I am, for the first time, because I've always been sort of on the fence about this, for the first time, I'm super excited to move forward with this. So,
Yay.
and thank you for seeing me that day. Yeah, I'm very excited. And so Patty has had her surgery already.
Mm-hmm.
This was one surgery we didn't get a day apart. So tell us about your experience and how you're doing.
So after losing I'm at 195 pounds lost to date, and so of course what comes along with that but excess skin, and so I first met Dr. Katzen. I had done a lot of research leading up to my weight loss, and I had met Dr. Katzen at an event, knowing that he was going to be there, and I wanted to meet his team and so forth, and met him several times, just doing research and also following people on YouTube who I knew had surgery, who I very much respected their opinions in the community. And so when I hit my goal in this past July, we had a final consultation, and my husband went with me, and we went through all the parts of my body that were most bothersome to me, and he assessed and made suggestions. And so anyways, on December 1st, I had an abdominoplasty, basically hip to hip. I had muscle repair of my stomach muscles. I had a breast augmentation and lift. I had liposuction of my upper thighs. And while Dr. Katzen was in doing my abdominoplasty, also known as a tummy tuck, he also found a hernia, which he was able to repair, which I'm completely grateful for because that would have been another side surgery. So I can't say enough great things about Dr. Katzen as far as he is just top-notch in his skill. It's so true. And you make your patients feel so comfortable and so cared for, and you're just extremely responsive. And my whole family is very, very appreciative of your care and the results.
Thank you.
So what, you're, what is it, like 7 or 8 weeks post-op now?
8 weeks, 1 day.
8 weeks, 1 day. Well, I can speak to the fact that you look incredible. How do you feel?
I'm feeling great today. This morning I did a walk and I did hills and everything just to kind of ramp up my walking and everything. And I felt great. I was able to get some cardio in, and it felt great. I was having to pace myself. I'm still pacing myself not to get overtired during the day, but I feel wonderful, and my body has responded so great, and I'm just really, really happy and thankful.
And I have to say, for me, one of the deciding factors to start moving forward was watching Patty's experience recovering and her experience with Dr. Katzen, because all I had done in the past was seeing YouTube videos where you just see a little piece of what people are going through, so it was really helpful to me to see you and to hear you tell me things over and over again when you were on drugs. But so that was a fun part. Okay, so I want to let you guys know I have the Q&A thing open on YouTube. If you want to ask questions there, you can also do my other favorite way, which is to just text me questions. My cell phone is 714-625-5663. We are pretty much focusing on traveling for plastic surgery because Dr. Katzen mentioned at the end of the last show he was on that he did Skype consultations and things like that, and there was a lot of interest around that. He is going to come on and do additional shows where we're going to focus on each of the body parts. We're going to do a show specifically for men and their plastic surgery needs post-weight loss. So we want to try to keep the questions focused in this area around traveling for weight loss surgery, but feel free to send me your questions either on the Q&A board or over text. So one of my first questions for you is, how did this, weight loss surgery or weight loss patients, and maybe not necessarily weight loss surgery patients, how did that become a focus for your practice?
And that boils down to a lot of surgeons, doctors, physicians go into a certain field usually because of 1 or 2 patients. And about 16 years ago, I had a patient who had lost about 400 pounds.
Okay.
And she'd had, at that time, a procedure called a phobia pouch, which for all intents and purposes is a type of bypass with a band on top. Mm-hmm. So she lost a significant amount of weight. And she worked at one of the regional ICUs in the hospitals, and she couldn't find a plastic surgeon that was willing to operate on her. Basically, she'd seen 12 plastic surgeons, and every one of them said, oh, you need to lose more weight, or, oh, there's too much extra skin, or, it's not going to be worth the scars. So she'd seen all these surgeons, and she came to see me, and she goes, I need your help. I really want this surgery. I don't care what the scars are. I need to get rid of this excess skin. And I got it. I understood. And I told her, it's going to require several surgeries. We're going to do the body lift first. A month or 2 later, we're going to do the legs. And then we're going to a month or 2 later do the breast and the arms. It's going to be fine. But you're going to have surgeries, and there will be scars. There'll be some pain along the way. But in the end, the reward will be so worth it. So she and I entered into this journey for her, and she had amazing, fantastic results. Now she dances competitive ballroom dancing.
Wow.
Pretty cool stuff after losing 400 pounds. She looks spectacular.
That's amazing.
Anyway, so, I saw her results. I saw her journey, her, going through all this, and I said, wow, that's a huge difference. That's a life-changing type of plastic surgery. That's what I want to do. Mm-hmm. My patients are highly motivated. They've gone through the weight loss surgery or diet and exercising, and I see the results as sort of, real, if you will. There's no way you can confuse my before and after pictures. It's sort of
right,
impossible.
exactly.
So we see results on the table right then and there. Not, oh, in a couple of months it'll get better and better and better. No, it's gone. So I do it for the patients. Patients are highly motivated, energetic, positive. They want to see results, and we do pretty big surgeries, and we get very good results. So it all boiled down to that one weight loss patient about 16 years ago.
Wow.
Yeah.
And what percentage of your practice are these kind of surgeries?
Yeah, most of my practice are weight loss patients. And when I say weight loss, it's at least 100 pounds or more. And I would say at this stage, it's probably about maybe 95, 97% weight loss patients.
Wow.
Yeah.
Great.
And the majority of that are through surgery, but we do have maybe about 20, 25% which are diet and exercise. But again, not diet and exercise, no, I lost 20 pounds. I have a patient coming up who had lost over 200 pounds with diet and exercise over several years. So, any way you lose the weight, we can help you.
Very good. So, Dr. Katzen, of those patients, how many live locally and how many come from other areas, whether in another state or another country?
Yeah, good question. About 40% of my practice comes from out of state. So that means out of the state of California. And from that, we've had patients from Hawaii come down, patients from Alaska come down, New Jersey, Virginia, North Carolina, and sort of everything in between, Texas, Oklahoma, Wisconsin, Milwaukee, many, many states coming to us for the surgery. But about 40% come from out of state. And of that, probably about 20, 30% also come from out of the country. So we have patients from the Middle East coming to see me. We have patients from Australia coming to see me, patients from Germany to come see me. So we get patients that are international that come to see us too.
And so how do they generally find you if they're coming from all these other places?
Yeah, with the advent of the internet. It's, the internet brings everybody, together, and literally we can be all over the world and we are on your cell phone or in your living room, wherever you are. So the internet's, an amazing, powerful tool, and that's how usually most of my patients find me.
And I know last time you were on, you talked about doing consults on Skype, which I didn't know you did. Do you want to talk about that a little bit, about how that process works?
Yeah, there are a couple of ways to do consults with me, before you actually physically meet me. A lot of patients will go online, fill out my questionnaire, and we also have a way for you to take pictures of yourself naked for me to get a good assessment of what everything looks like. So some patients opt for filling out the questionnaire, sending their pictures to me, and then we do a phone consultation. And over the phone, I can look at the pictures and do the phone consultation with the patient. Another way to do it is we do Skype phone calls. And we can do Skype, we can do FaceTime, whatever you wish. And during those Skype consults, patients can actually show body parts to me of areas that they are concerned about. Of course, everything, is strictly confidential. I'm a medical doctor. It's very professional in what areas people are concerned about and what surgeries can be targeted to those. And then typically we'll decide what surgery needs to be done or surgeries need to be done and in what stage. And then the next day we'll contact them and discuss dates and prices and things like that. And then if all is good, then we ask the patient, if they've selected a certain date, to get their labs and their EKG and chest x-ray done locally, wherever they are in the US or the world. Send those labs to us. Most of the time, 90, 95% of labs are perfectly fine. And then the patient flies out to see us. And usually, we're talking probably 98% of the time, what we discuss over the phone with pictures or what we discuss on the Skype consult is actually the surgery that the patient needs. It's rare that a patient comes out and I say they need a tummy tuck, and then when they see me, oh no, you just need liposuction. That's not happened in 16 years. So,
but what they don't get is the magic mirror where you held my arms up and showed me what they would look like. I was like, okay, arms too.
Yep. Our mirrors are the same as yours at home. Fortunately I do only areas that bother you. So patients will tell me, oh, my arms bother me, and that's enough. If their tummy's fine, we don't touch the tummy. But a lot of the times it's oh, what do you think about tummy? And I'll say, you know, tummy tuck or liposuction or maybe even a body lift. Just really depends what the patient needs.
Mm-hmm.
But the Skype phone calls make it so effective because you don't have to battle traffic in California. You don't have to jump on a plane. I mean, you can get very, very top-notch medical care from super specialized doctors in very specific fields. And it doesn't just, you know, cross to plastic surgery.
For
it
sure.
crosses over all medical fields now.
Yeah, telemedicine is huge now.
Exactly. I mean, remote medicine for, you know, even blood pressure and insulin modification for patients that are way, way out off the grid is amazing. So it's all good. It's all good.
Very good. Will you walk us through the process a little bit in terms of what happens when a person lives out of the state or out of the country and then decides to come to LA for plastics?
Yeah. So typically we get all the labs and make sure it's safe to do surgery. And
you do that before they come, right? Did you say you do that before they come? Okay.
So, correct. So they typically do that with their local doctor. And I like that better because their local doctor knows that patient and may have known them since childhood. So, you know, knows that patient very, very well. And if there are any irregularities, their local doctor can treat those. But for the most part, my patients are pretty healthy or much healthier than they would have been with the weight on. So even before they fly out, we've talked about the procedure, we've examined them on the phone or examined them through Skype, and we see their labs. And then when they come in, typically you'd fly in maybe on a Thursday or a Friday, and I would see you on that Thursday, Friday, or Saturday. And then sometimes we'd go into surgery on that Monday, okay? Honestly, I would say about half of my patients come out a week early, and they go to Disneyland, and or they go shopping, and they sort of enjoy Southern California before we get down to business on Monday and do the surgery. So patients will fly out usually about a week earlier, but then they'll see me, and then we'll perform the surgery. And depending on what kind of surgery is needed, will dictate how long they need to stay in town. Right. Typically the minimum for out-of-state patients will be 4 days. You know, so I'd like, you know, we'll do the surgery, and then you spend Monday night, Tuesday night, Wednesday, and Thursday night, and if everything looks good, you could probably fly on Friday or Saturday.
Gotcha. Yeah. Okay, so that was my next question. So you hit right on that. So
yeah. Okay. So that really depends. That really depends what type of surgery we're having. You know, the bigger surgeries, the body lifts and the leg lifts. Yeah, I'd like you in town a little bit longer, maybe about a week to 10 days. If you combine the body lift and the leg lift at the same time, maybe we want you in town 10 days, 2 weeks. Really depends on the patient, the procedure, you know, how far they're traveling. Are they flying overseas back to the Middle East, back to Australia? You know, it just depends.
Okay. And where would they stay? Do they need to stay relatively close to Beverly Hills area? Do they make their own reservations and stay with family or friends? And you can tell us a little bit about the surgery center too, the aftercare facility.
Sure. The best way to recover from one of these is ideally to stay with family that live fairly close to the area of Beverly Hills. But typically that's within about, we call close in Beverly Hills, within about an hour radius of Beverly Hills. You know, if it's an hour and a half, I'm not going to pick on you, but, you know, if you have family, friends, you know, in that region, that's the best way to recover. But if you don't have friends or family in Southern California, we do have some arrangements with local hotels where you can stay there at reduced rates. Right after the surgery, you'll have the surgery, and then you'll be in the recovery room for at least an hour, maybe 2 hours, while the anesthesia gets out of your system. And then you go, if you desire, and if the surgery dictates it, like a body lift or a leg lift, bigger procedures, you go to my recovery center. And a recovery center basically is a very, very fancy hotel where my nurses watch you, your IV's in place, the bladder catheter is in place, and basically it's like a fancy one-on-one hotel because you get a board-certified registered nurse watching you, watching your vital signs. You need the nurse, you push the button, he or she comes running. And typically after the body lift or the leg lift, we'll have you stay in one of those facilities, maybe 1 or 2 nights, but I've had some patients stay in a facility like that for weeks, but you don't have to. That's sort of the extreme. Okay,
Right.
that patient was out of state and wanted to stay a little bit longer.
So I've been to the hotel where it is. It's a very nice hotel. Patty, what was your experience?
I was just going to say, can I just share that my experience?
I love that hotel.
My experience at the aftercare facility it was wonderful. It was relaxing. My husband actually got to stay there with me. Dr. Katzen came each morning while I was there. It was really nice to wake up and see, Dr. Katzen there to, just make sure everything was great. But the nurses were excellent, and I just felt really comfortable there. I almost was like, gosh, I could stay here for quite a while. This is pretty nice and cushy. It was very comfortable.
Yeah. Yeah, it's a great way to recover, and for us, it's much better to recover in a situation like that, where my nurses are watching you, as opposed to, one, sending you home and hoping for the best, or number two, you're in a hospital where there are a lot more hospital germs and nurses going from sick patients to healthy patients and potential contamination of wounds and horrific things like that. So these are the ideal settings, I think, for the procedures that I do.
I never even thought about that, going from, sick patients. That's such a great point. I never thought about that.
So if someone were coming, and so say they stay a day or two in the, what do you call it? Aftercare? I would call it a recovery center. What do you guys officially call it?
Same thing.
Okay.
Aftercare center or recovery center. Yep.
So, and then if they don't have family or friends here and they go to a hotel afterwards, would they need someone with them to help take care of them?
It's good to have a friend or family with you. Yeah, just one. They don't have to have a special certification or anything, but just to help you get sometimes from bed to bathroom, maybe get groceries, things like that. Just a helping hand. Yeah, it makes a big difference.
Okay. All right. What about traveling? If the patient leaves with drains in, is that an issue? If they're going back home?
No. Typically after a body lift or a leg lift, I'll have drains. I don't use drains normally for the arms or the breast, but for the body lifts, tummy tucks, legs, we use drains for multiple reasons. Sometimes patients will drain too much fluid, and the drains aren't ready to come out before they're planning to travel home. But if all the incisions look fine, I'll let patients fly home with the drains. The drains don't have any metal in them. They won't set off the metal detectors at the airport.
Can you tell the story you told us about security at the airport?
I always, worry about patients, when they're going through airports with this day and age of high security, which is good all the way around. But one day I'm in the operating room, and over the loudspeaker we have in the operating room, my office is calling, and they're like, the police from LAX want to talk to you. So in the middle of surgery, I'm like, I think I better take this call. So I take the call in the operating room. I'm like, yeah, this is Dr. Katzen. And they go, yeah, we have one of your patients here. I'm like, yeah. And they go, we're just calling you because his picture doesn't match up what his driver's license looks like. And I go, oh, because that picture was taken on his license before his massive weight loss. And they're like, oh, okay, but we just wanted to be sure. I'm like, okay, let him go, so it's fine. So,
I just thought that was funny.
When the police call, you got to take the call.
Yeah, absolutely. So would a patient be well enough to walk through the airport? Do they need a wheelchair?
Really depends on the patient. Really depends on the patient, but the extreme could be, you could walk through the airport to the point, but I would suggest make it as easy as possible. I would call the airline ahead of time and tell them you need, I think it's called curb to airplane service. Literally, you drive up your car, you get in a wheelchair curbside, and that assistant will take you through security, to the gate, down the runway, onto the hull of the plane, and sometimes even they'll assist you into the seat of the plane if you need that. So that's the easy way to do it, and that's what I suggest to patients. I would say of the patients I suggested to, probably 70 or 80% do it. Another way you can do it is with a walker, but the wheelchair just makes it so much easier. Keep it easy. Yeah. Do it easily. Yeah.
Yeah. And Lorraine had asked, Lorraine, who was one of the other people that was staying with me when we came to see you, had asked about cabin pressure. Does that affect the drains or anything, particularly for those who have long flights?
Very, very good question. The drains work on negative pressure, so that means there's a little ball and you squeeze it, and the ball has plastic in it, and it sucks blood out. It has nothing to do with cabin pressure. You'll be totally fine. Cabin pressure is usually pretty normal. Atmospheric pressure, maybe a little bit more than atmospheric pressure, but it's not going to affect the drains whatsoever. And just to put it out there, it's not going to make breast implants blow up either. There's sort of an urban myth out there that somebody died because her breast implants blew up in an airplane. No, it does not happen. So I'll go on record for saying that is totally safe.
And one of the things... Oh, go ahead, sorry.
Some patients worry about silicone implants, saline implants, and cabin pressure. Well, no. And I have a fair number of patients who are stewardesses with breast implants flying as a living, and they are totally fine. Totally fine. Yeah.
Awesome. One thing that I think sort of relates to flights is that I was surprised of when Patty was recovering was that she wasn't supposed to walk around much, because you know how they always tell you on planes you need to get up and walk around. So I guess that wouldn't be an issue post plastics flying long distances.
Yeah, the issue is blood clots. And that's sort of one of the big fears in whatever surgery you're doing, orthopedic surgery, hip replacement, liposuction, tummy tucks, especially body lifts and especially leg lifts, high risk of developing blood clots. But there's also a high risk of wound breakdown if you're moving around too much. Mm-hmm. So it's sort of a double-edged sword. And I've gotten away from having my patients ambulate a lot. In fact, I would rather them go home and go to bed and stay in bed. Okay. But the flip side of that, that increases their chances of blood clots. Well, the way I combat that is I have you take a blood thinner shot every day for about 2 weeks. Okay. And since I've instigated that, the incidence of blood clots in my practice has pretty much evaporated, gone away. Right. So important for blood clots to use the blood thinner, and it's important in my patients, at least for the surgeries I'm doing, to stay in bed. Yes. Not move around too much. Yep.
Great. Yes, and it's not hard to give yourself a blood. Just a quick note: it's very easy to give yourself the blood thinner shot. I mean, very simplistic. It doesn't hurt. And
did you do it? Do you do it yourself?
I did do it myself. Yeah. That was the one thing that my husband wasn't super comfortable with. Everything else he did, but just that, and it doesn't shots don't bother me whatsoever. So, and they literally you don't feel it. So, as far as people who are traveling and they go home, how is their post-op care monitored?
Yeah, basically every couple of days I check in with you. We'll send an email out and say, you know, how are you doing, or how are the drains doing? Is everything healing? Patients will text back or call back and say, yep, no problems. Or if they're worried about anything, they can easily take a picture of it and email it to me right away, and usually within a couple hours I can get right back to you. And if it's concerning, you know, we'll have a phone call or a Skype call or go over areas of concern digitally, just like we're doing here.
And I had that situation myself. I just had a question, sent Dr. Katzen a message, and was able to get. He was very great to respond always. So, and I thank you for that.
I have to say, being a doctor's daughter and having worked with lots of doctors, you are the most responsive doctor I've ever seen.
Oh, thanks. Thank you. That's good to hear. That's good to hear.
So what happens if something does go wrong when they're home? If there is a complication that comes up?
Sure. About 90, I would say 99% of the complications that do arise, we can handle over the phone. So if the patient's worried about something, they will call me, email me, text me. Usually they're wound issues or wound problems, you know, separations of wounds, little openings of wounds, and 99% of those we can handle over the phone in terms of, oh, let me switch your antibiotics. Oh, let's do a different type of dressing. Oh, let's do this cream, let's do this ointment, and they heal up. It's very rare. In 16 years, maybe 1 or 2 times we've had to contact local physicians to help out in the care of the patient, but extremely rare, extremely rare. Because we can handle most of the stuff, again, over the phone.
Hmm.
Yeah. The beauty of telemedicine.
Yeah, it's amazing.
Yeah.
Okay, as far as insurance goes in regarding complications, if they return to their home and experienced complications, how would, I mean, I know you're not an insurance expert, you're a doctor, but how would that play into it?
And talk a little bit about that insurance that everybody can get, too.
Yeah, and we're talking, I think, about 2 different things right now. But if the patient has surgery and they have complications after the surgery, it really depends on their insurance as to what's covered and not covered. Okay. So with Blue Cross Blue Shield, it may be covered, it may not. With Aetna, it may be covered, it may not. And even within the insurance, there are multiple levels. You know, there's platinum, gold, silver, and then different professions have different strata. So some are covered, some are not. So there's the private medical insurance. Now, it shouldn't matter if you go out of state for your procedure. The insurance companies usually are nationwide. So that means to say if you have, I don't know, say Blue Cross, and you go to Tennessee for vacation, and you get injured in Tennessee, well, your insurance is still going to work. Okay, they're not going to say, oh, you're in Tennessee, you got to get Tennessee insurance. No. So the same thing would apply for complications that occur when you have surgery outside your home state. Okay, that's a big generalization.
Mm-hmm.
Then the second thing you alluded to was the extra insurance you can buy. Now, with the American Board of Plastic Surgery, which I'm certified by, there's another program that we're involved with where you can get separate coverage for your plastic surgery procedure for big complications, blood clots, bleeding, rushing back to the operating room within several hours. I think the insurance costs maybe $250 or $300 for that extra coverage of about 2 weeks. And that's fantastic. That's one of the best deals you can get for insurance. And it's a really good policy to have. If you're going to have plastic surgery, or ideally any surgery, see if you can get extra coverage like that through your doctor. Yeah.
Great. So are there patients who wouldn't be good candidates for traveling for plastic surgery?
I imagine there would be patients that, in my practice, if they haven't lost all their weight, they need to lose all their weight and plateau and be ready for plastic surgery. I would say if you're on blood thinners, Coumadin, dialysis patients, COPD patients, smokers, chronic smokers with lung problems, maybe not a great idea for patients to fly. However, we screen most of those patients before because we've done that phone consultation, we've done that Skype consultation, and during that screening, we would have assessed, it's probably not a good idea to, 1, have plastic surgery, or 2, fly all the way out here for that surgery. Yeah.
Right. Now, like I was saying about my consultation with you, we would be breaking up my procedures into 2 different days in the operating room, not back to back. So how does that work if somebody's traveling and they're having their surgeries broken out like that?
Yeah, there are 2 types of patients in that situation. There are patients that, Dr. Katzen, I'm a teacher and I got to get it all done this summer. Okay. So we do your surgeries back to back to back. So that means we would do your body lift and your legs, and depending on how you heal would lead to when we could do the next surgery. Sometimes it's 2 weeks, sometimes it's more likely 4 to 6 weeks after your initial surgery. So they come out, we do the first surgery, 4 to 6 weeks later, we're doing their second surgery, and then once they've healed up from that, if they're only doing 2 surgeries, they can fly back home. If we're doing 3 surgeries, then they may have to wait another couple of weeks after their second surgery for their last surgery before they fly out. So they may be out here a month, 6 weeks, maybe 2 months to get all those surgeries condensed. That's one type of patient. Another type of patient is like, well, I'm going to do my tummy, backside, and legs this year, and next year I'm going to do the arms and the breast. So they come in for tummy and legs and stay for maybe 7 to 10 days, fly home, and then a year later come back for the arms and the breast. So 2 types of patients.
Okay, great.
Yeah. All right. So I know you talked about this on the first show that we did, but can you share a little bit about choosing a plastic surgeon, and in particular, if you're choosing one that you have to travel to?
Yeah, I think it's very important. When you're choosing a surgeon, you should choose a surgeon that's certified and specialized and has really done the training thereof. So if you're looking for a plastic surgeon, you should be sure that they are certified by the American Board of Plastic Surgery. It's fairly easy. You can go to a website, www.plasticsurgery.org, plasticsurgery.org. On that list will be doctors, surgeons that are certified by the American Board of Plastic Surgery, took all the tests, and are allowed to practice plastic surgery at the highest level. In addition, that should also allow them to have privileges at local hospitals in case, God forbid, something went wrong and you had to go to the hospital. That doctor could admit you to the hospital and take care of you in the hospital. What happens a lot in California is there will be a non-plastic surgeon doing the surgery. Something may go wrong. The patient gets admitted to the hospital, and then the patient's like, uh-oh, where's my surgeon? Well, the surgeon doesn't have admitting privileges because they're a dermatologist or they're a gynecologist or an oral surgeon. So they can do the surgery in their surgery center, but if anything, God forbid, goes wrong and you go to the hospital, they can't even come see you. Okay, they can see you as a visitor, but they can't suggest, oh, she needs blood thinners, oh, she needs, antibiotics, versus somebody who is board certified and has hospital privileges in that field can admit you to the hospital, take care of you in the hospital, get you all fixed up in the hospital. So it's very important to, one, make sure they're board certified in their field, in this case, plastic surgery. If you're looking for an orthopedic surgeon, you should be sure they're certified in orthopedics. So board certification. Okay. 2, that they have hospital admitting privileges in their field. So when you see your plastic surgeon say, God forbid, if something goes wrong, what hospital are we going to? And they hopefully can rattle off a whole bunch of hospital names where they can treat you and admit you. Not say, well, we can get you in over here, but, Dr. Smith will be taking care of you. Okay. And then I really think the third thing is very, very important. You need to find somebody that's done thousands and thousands of these. You don't want to be somebody's guinea pig. You don't want to be, oh yeah, I did one of these, but we'll get you a really good deal and you'll be all right. No, you want to go into their office. You want to see hundreds and hundreds of pictures to the point where you're like, okay, I'm done seeing pictures. You want to go to their website and just see, okay, I'm sick of seeing all these pictures. I get it. He's done more than 2. Go online, see the reviews. You just don't want 1 or 2 reviews. Oh, this doctor, he does great Botox. Well, that may be great, but he may or she may have never done a body lift in their life. So if you're going there for Botox, great, go there for Botox. But unless you have good reviews of patients that have been through the same procedure, that's very important when you're looking for a doctor. So board certification, plastic surgery, hospital privileges in plastic surgery, experience, done hundreds and hundreds and hundreds of these, and sort of your independent review on the internet, just sort of making sure, what the doctor says is backed up by real patients.
Absolutely.
So there are a couple of different reasons I think that people would travel for plastic surgery. One, of course, is for cost. If they're traveling internationally, they may be able to get it done for less. But I think, as it relates to you in particular, it's about traveling to someone who is an expert and does this a lot with weight loss patients. Can you talk a little bit about why that's important? What's different about somebody who's done 9 million tummy tucks, that are really just like mommy makeovers versus, doing them with weight loss surgery patients? What's the difference?
Yeah, weight loss patients are a lot more different than sort of an average person coming in perhaps after a pregnancy or maybe after a 10 or 20 pound weight loss, because the skin, the fascia, and the muscle are much, much different than patients who have just lost a little bit of weight or just want a mommy makeover, if you will. The skin is much more elastic, so you have to pull a lot harder than you would on an average patient. You've got to dissect or free up the planes on the tummy tuck well over the rib cage so you get a really good tummy tuck. You have to plicate or stitch up the muscle really tightly because that muscle has been stretched out. So if you do the same approach for a weight loss patient as you would for somebody who had lost maybe 10 or 20 pounds, you're not going to get as good a result. You have to be a lot more, if you will, more surgically aggressive with weight loss patients to get very good results. Yeah. Good question.
Yeah. If people do decide to travel outside the United States for surgery, are there certain things that they should keep in mind or be aware of?
Yeah. Number one, I wouldn't do it. Okay. The reason being is, and I didn't know this till a patient mentioned it to me. I was giving a lecture in Orange County, and I was talking, and the same question came up: what do you think about traveling overseas? And I said I would not suggest it or do it. And a lady stood up in the audience, and she says, I completely agree. I would never travel outside the U.S. again. Okay? She was a nurse in the U.S., and she sort of knew the system and probably knew of doctors to go to, but she decided to go outside the U.S. for her treatment. She had a tummy tuck and some liposuction. Complications happened. She needed a blood transfusion. Okay, it happens. She got a blood transfusion. However, the blood transfusion had hepatitis C in it. Okay? Can happen, I guess. Rare in the U.S., but it can happen. One of the problems with hepatitis C, it's difficult, if not impossible, to treat or cure. So then she comes back to the U.S., and she finds out, oh, she has hepatitis C. Okay, bad in and of itself to have a complication, bad to have a blood transfusion, really bad to get hepatitis C. But then, the worst part of it, she couldn't get her U.S. insurance to cover her because she had a complication from elective surgery done outside the U.S. So she can't get any treatment for hepatitis C.
Wow.
So God forbid, any complications happen, and then God forbid if you do get complications, your insurance company in the U.S. may not even touch you if you get a complication. So there are multiple, you can go on the internet, there are multiple, even the CDC said a couple of years ago for certain areas in South America that they do not advise Americans going for plastic surgery. That's the CDC, Centers of Disease Control. They sort of monitor global and U.S. Pockets of disease. So, when our government says, don't go there for surgery, it should be a heads up for everybody to sort of beware. So, I'd be very leery, very careful about going outside the U.S. for especially medical or especially surgical care. The doctors may be great. They may be, trained in the U.S. and maybe have an office there. But I would be careful of that situation because then even the aftercare, you may have nurses and ancillary staff that are not properly trained and they may not know what they're doing. So sometimes it's not just the doctor, it's also the team around them. Anesthesiologist, the nurse, the recovery center. So it's not just the surgeon sometimes too. So I would be very cautious, very leery.
The certification process, it's different, or they don't is the certification process you're talking about just for the U.S.?
Yes. Now, the U.S. has very strict laws on what one needs to do and pass to become board-certified plastic surgeon.
Mm-hmm.
So you need to do a certain number of years of general surgery. So you know the foundations of surgery. Then you need to do a certain number of years of plastic surgery. Then you take several written tests, and then you take several oral tests. And then yearly, we always have to do a certain number of hours of credentialing to keep up with the current treatments in plastic surgery. So it's a very rigorous training. If somebody from outside the U.S., from another country, wants to practice plastic surgery in the U.S., they typically have to redo all the training, the years of residency. In my case, I did 13 years of training. That's after medical school. So 4 years college, 4 years medical school, 13 years of training, and then private practice.
And you look so young.
Thank you. Thank you. So, genetics. Yes, genetics. So, so other countries may not have that type of criteria. A lot of countries have 6-year program of medical school where they combine university and they combine medical school. So instead of 8 years, it's 6 years. And then their surgical training can be 1 or 2 years, and then that's it. And then they're ready to practice. Is that good? In that country, it's acceptable. But in the U.S., we have very strict laws of who can do what and what training is required. Yeah.
So before, I'm going to throw in a question that somebody sent in just because I think it's a really good question and I haven't heard anybody talk about it, and it's a curveball because it's not totally associated with this. But is there Les of Kevin, who's someone who's pre-op, had asked if there's incidents of depression following plastic surgery?
Yes, there is. Okay. And I can explain it physiologically because if you think about it, fat stores a lot of hormones, estrogen, testosterone, and a lot of other hormones. During surgery, I'm removing sometimes 10, 15, 20, 30 pounds of skin and fat. That's a lot of hormones in that fat. So sometimes after the surgeries, the hormone levels have been removed, and the body is like, what just happened? Okay. Then you got rolled into there, a whole bunch of anxiety. You've got pain medications on board, sometimes antibiotics, sometimes the nausea medications. You got all that rolled up. So yes, absolutely huge mood swings.
And that's usually temporary, right?
Yeah, very temporary. So usually patients get through that, depending on the patient, maybe 1 or 2 days, maybe 1 or 2 weeks, and then done. One of my favorite stories was school teacher, and she'd lost, I think, maybe about 300 pounds, and we did body lifts, and a couple of months later the leg lift, a couple of months later the arms, a couple of months later the breast, and she's in her final procedure. And I get a call from the nurse at the hospital. She goes, you got to come see this patient. She's crying uncontrollably. I'm like, it's 2 o'clock in the morning. Do I really have to come to the hospital? Yep, you got to come. So I go in there. I'm like, Susie Q, what's the matter? She goes, I'm really sad and scared. I'm like, well, what's the matter? She goes, I don't know what to do. I'm like, what do you mean? She goes, well, how do I act skinny? How do I act thin? I'm like, I never thought about it that way. She was terrified and depressed because she didn't know what to do or how to act. I'm like, you'll be fine. So patients go through some pretty significant psychological roller coasters after these surgeries and during these surgeries. It's scary. Yeah.
And I think that's something that we're all sort of familiar with who've lost weight too. That part that's hormone related, we sort of have some of that going on too as the fat's releasing. And also, just like what your patient said, how do you adjust? How do you adjust to this whole new life that you have?
I can speak to the. Sorry, Dr. Katzen.
No, it's good.
I could just share that between weeks 2 and 3, I had 2 days where I had emotional and crying, and I couldn't even explain why. It was just for an hour or 2 each day, and I felt terrible because my family's around me and there's nothing that they can do to make me feel better. I just had to get it out. And after I got it out on those 2 days, I was fine. But it's good to know I wasn't completely going crazy.
No, it's very normal. And we can explain it, physiologically because, all that fat is gone and the hormones are like, what am I supposed to do now? Yeah. So. Okay.
So we're getting a couple questions in that really don't pertain to this topic and that I think we're going to cover when we do some of the other shows on specific body parts. So know that I've seen your question. Know that I'm going to add them to our list for when we talk about specific procedures. So I don't want anybody to think I'm ignoring them. Is there anything else you can think of that people might need to know in terms of traveling for surgery, particularly within the U.S.?
Yeah, I would say in this age of telemedicine and this age of digital technology and really the huge advances we've made in communication. The access now to doctors and specialists, really in any field, has been just fantastic. So, I mean, you can seek out the best doctor in the U.S. in any field, call them up, and almost arrange to fly out there and have surgery in almost any field you're talking about. So, you know, in this day and age, I would really consider researching the internet, trying to find the best guy or girl that's good for you and the procedure you're seeking, and then really consider flying out for procedures. Because the insurance companies and, you know, big companies, GM, Ford, you know, Northrop Grumman, they've looked at this, and they've looked at outsourcing procedures, and traveling has become a huge industry for medicine and surgery. So why not travel within the U.S. to get your procedures done? It's very commonplace now, I should say. Whereas before, even 20, 30 years ago, people were like, why are you traveling? Well, now you can, number one, and you can get excellent care and travel home having received excellent care, sometimes outside your state, your home state.
Right.
Yeah.
Okay.
Okay, so we know you're a surgeon and not an insurance specialist, but do you have any suggestions for people who are trying to get their insurance to cover their surgeries or procedures, and does it make it more difficult if you're traveling to another state?
No, it doesn't make it more difficult if you're traveling to another state, but I would suggest being just very annoying for your insurance company. Okay. By that, I would, you know, you have insurance. You're not doing them a favor. Sorry, you are doing them a favor. They should reciprocate in giving you procedures if it's medically indicated. Okay, so that means it shouldn't just be a one-way street where you just give them all your money and that's it. Okay, so being annoying to the insurance company would be, okay, if you're in a certain plan which restricts you to certain doctors, you have to see those certain doctors, like an HMO or certain smaller insurance brackets. But if you have a PPO insurance where you can go to any physician you choose, go see that physician, see if they work with insurance companies, and then take the necessary pictures, document any rashes. If you have any rashes, take a picture of it, document it on your phone, write it down in your journal on, you know, January 27, 2016, I had a rash and I applied this cream. And just keep records of that. So when the time comes to submit to the insurance company, you've got a nice stack of papers and pictures that say, you know, this is what I have, this is how I treated. You know, it's not just a once or twice kind of thing, it's for real. And then each time you have a rash, I would also suggest calling up your doctor and say, remember me, I want an appointment. I may not need it, I may not need the appointment because I know how to treat it, but I want it on my medical record, I want it documented. So when we submit for insurance, I have documentation from you in my medical chart that this is a real issue. This is a real issue.
Okay.
Great.
All right.
And a lot of procedures are covered. It depends on your insurance, of course. But I've had tummy tucks covered. I've had posterior body lifts covered. I've had legs covered. I've had breast lifts covered. I've had the arms covered. The face isn't covered, except sometimes the upper eyelids can be covered. But the rest of the face usually is not covered.
And someone had asked about financing. There's like, is it care credit, or I mean, there are financing options.
Yeah, most plastic surgeons have financing companies that they deal with, and
right.
They're good. You know, if your credit is good, you know, you may be able to get loans through banks and credit cards too. Those are other options. But some of these other programs where their credit lines, they're very good too. Yeah.
Great.
Very good. Well, Elizabeth, were there any additional questions?
Nope, that's it. I think all the other questions we got, we're going to save over to the shows where we're talking about specific procedures.
Okay, awesome.
Okay.
Dr. Katzen, thank you so much. If somebody wants to get in touch with you, we just appreciate you so much. And if somebody wants to get in touch with you to schedule a consultation in person, or even through Skype, what's the best way for them to contact you?
Sure. By phone, traditional phone. It's 310-859-7770. Or you can just jump on the internet and type in Katzen, that's Katzen, and my name will pop up, Beverly Hills, and just give us a call and we can do a Skype or a phone call or come in for a physical consultation, whatever you wish.
Great. Well, thank you again. Dr. Katzen's going to be back with us on March 16th. I think we decided we're going to be talking stomachs and body lifts and all that stuff. So I will remind everybody to get their questions in before that. And Patty and I are going to be back together on Sunday. We were supposed to have Kirk, VSG Kirk, with us, but he had some unexpected travel. So Jamie, VSG Betty, is going to be on, and she hasn't made videos in a little while, so I'm going to post her link on The Naked Truth and on my webpage. And don't forget, like, share, and subscribe, because if we get enough subscribers, I can do some cool things at YouTube Space. All right, guys.
Dr. Katzen, thank you again.
All right.
Yes. And
Thank you very much.
See you guys on Sunday.